And so COVID-19 positive cases skyrocketing across Texas right now, more than 8,000 new cases today alone. And surprisingly, many of those new cases are being reported in rural communities. Our Nora Perez spoke with experts about that today, and they say this should be an alert to all Texans.
Rural communities have the advantage of low population densities. Human contact is less frequent as compared to metropolitan areas, but that doesn't mean that infection is not going to take place there. It will. And it only takes one contact to get infected.
Dr. Juan Gutierrez of UT San Antonio says the rate at which COVID-19 is spreading across rural Texas should be a wake-up call to the entire state. This week, one coastal Bend county saw an explosion in their positive cases, numbers in Duval jumping from 6 to 50 in just 7 days. Other counties of similar populations are also seeing their cases climb. But why? Dr. Joseph McCormick, an epidemiologist with UT Health at Brownsville, says young adults are suddenly leading the pack when it comes to positive cases and transmissions.
From before the quote opening of the economy before Memorial Day, when it was about 30% to 35%. Now, these younger adults make up something like 60 to 65% of our cases.
That age group is also contributing to rising numbers in children and older adults.
All coming from known contacts. So this is further evidence that this group of younger adults is really driving the transmission.
More widespread testing is, of course, increasing numbers in all areas of the state and across all demographics. But one thing that is not increasing is hospital capacity. And the medical crisis we're seeing in large cities.
Houston has already depleted the hospital capacity, and Houston has one of the largest hospital systems in the world.
It's just a matter of time until that happens in our rural hospitals.
We can't build new hospital beds overnight. That's the situation.
Nora Perez, 3 News.